Define pharmacology. Pharmacology is the study of how drugs interact with living systems through chemical processes. It includes pharmacokinetics, how the body absorbs, distributes, metabolizes, and excretes a drug, and pharmacodynamics, the biological effects of drugs and their mechanisms of action. Define bioavailability and half-life. Bioavailability is the fraction of an administered drug that reaches systemic circulation in unchanged form. Half-life is the time required for the plasma concentration of a drug to decrease by 50%. Define first-pass metabolism. It is the metabolism of a drug in the liver and intestinal wall before it reaches systemic circulation after oral administration. This significantly reduces the bioavailability of drugs taken orally. Define therapeutic index. It is a measure of drug safety, the ratio between the toxic dose and the effective dose. Therapeutic index equals TD50 divided by ED50. Here, TD50 or median toxic dose is the dose that produces toxicity in 50% of population, and ED50 or median effective dose is the dose that produces desired effect in 50% of population. Difference between potency and efficacy. Potency refers to the amount of drug required to produce an effect of a given intensity. It is measured by EC50, which is the dose producing 50% of maximal response. A more potent drug reaches its EC50 at a lower dose. Efficacy refers to the maximal response, Emax, a drug can achieve regardless of the dose. It is a measure of the drug's effectiveness in producing a biological result. Higher efficacy means a higher maximum biological response. Define drug tolerance and tachyphylaxis. Drug tolerance is a gradual decrease in response to a drug with repeated use, requires higher doses for the same effect. Tachyphylaxis is a rapidly developing decrease in drug response after repeated doses over a short period. Define clearance and loading dose. Clearance is the volume of plasma from which a drug is completely removed per unit time. A loading dose is a higher initial dose given to rapidly achieve the desired therapeutic plasma concentration. Difference between affinity and efficacy. Affinity refers to the ability of a drug to bind to its receptor. It determines how strongly the drug attaches to the receptor. Higher affinity means the drug binds easily, even at low concentration. Efficacy or intrinsic activity refers to the ability of a drug to activate the receptor after binding. It determines the magnitude of response produced. High efficacy means greater biological effect. Difference between first-order and zero-order kinetics. In first-order kinetics, a constant fraction of drug is eliminated per unit time. Most drugs follow this pattern, for example penicillins, propranolol. In zero-order kinetics, constant amount of drug is eliminated per unit time, regardless of concentration. Examples include phenytoin, ethanol, and high-dose aspirin. Difference between agonist and antagonist. Agonist is a drug that binds to a receptor and activates it, producing a biological response. It has both affinity and efficacy. Antagonist is a drug that binds to a receptor but does not activate it, blocks agonist action. It has affinity but no efficacy. Explain the terms: affinity, efficacy, agonist, and antagonist using receptor interactions. Understanding receptor interactions is fundamental to predicting drug behavior. Affinity determines binding strength. Efficacy determines activation magnitude. Agonists activate, antagonists block.